Independent primary care. This is a topic oh so important to me, and I want to tell you why. But first, let's align on what that term means. I think historically, we may have thought of independent primary care as those small autonomous practices independently owned by a physician, nestled in a community. And I do think that meets the definition of independent primary care, but I want to expand it for us a bit. Primary care can be found in a variety of settings and delivery models and payment models. But for me, independent primary care is about autonomy and the associated incentives. The autonomy to design and deliver care according to the primary care agenda and not according to the agenda of a hospital or a health system or really anyone else with a set of incentives which threatens the very ethos of primary care. So now I'll tell you why independent primary care is so important to me. In primary care, it's our job to keep patients healthy and well, to keep them out of the hospital, to keep them out of the emergency room, to prevent the kinds of heroic and expensive care we all hope we never need. And we do this through prevention and health promotion, through our comprehensive approach to care, through coordination of care across the complex healthcare spectrum, and through that trusting, sacred relationship with our patients. Anytime success in primary care is defined as anything other than that, we've lost our autonomy. And with it, our power to do good in society, the kind of good that only primary care can do. So to really reap the benefits of primary care and all the potential it holds, primary care must operate independently of superimposed incentives which contradict primary care's purpose. So to me, independent primary care is that which is divorced from hospitals, health systems, or any other entity which creates revenue for itself by disempowering primary care or making primary care subservient to a contradictory agenda. In independent primary care gets to lead. So with that said, let's get started. Hello and welcome to The Pulse, the Elation Health on-demand interview mini-series discussing hot topics across primary care, health tech, and the healthcare landscape. I am your host, Dr. Sara Pastoor, family physician and Senior Director of Primary Care Advancement at Elation Health. The topic of today's interview is current trends in independent primary care. Folks, from the moment the idea for this show was born, I knew I wanted to interview today's guest. She is one of Elation's most important leaders, and I am honestly in awe of her. She is brilliant, she is articulate, she's kind, and her passion and expertise when it comes to primary care inspires me and really everyone who knows her. I'm so grateful for everything that she does to champion primary care, and I just love learning from her. Manisha Goud is Elation Health's Vice President of Solutions, where she is focused on enabling primary care-led organizations to build and scale their businesses and care delivery models, leveraging technology to do so. In the 10 plus years Manisha has spent in healthcare, her focus has been steadfast on how to improve healthcare delivery outcomes through the lens of the clinician. She holds bachelor's degrees in both biological sciences and political science, as well as a master's in public health with an emphasis on health policy and services, all from the University of Southern California. We are incredibly fortunate to have Manisha on the Elation Health team and on the Pulse today. Welcome to the show, Manisha. It's so good to have you here.
Wow, well, thank you so much for that intro. I am very excited to be here and discuss what we love to discuss, which is how we can really make an impact in independent primary care. And I think this is a great topic to be able to just speak to you about today because we speak about it so often. And excited to share that with the Pulse.
We do speak about it so often. I often think other people should be hearing us talk about this.
Exactly.
To be clear, other people should hear you talk about this. So great. Let's go ahead and jump into our very first question. Okay, so give me the zeitgeist. What trends are we seeing in the market as these independent primary care physicians continue to try to sustain and expand the access to high quality primary care?
Yeah, definitely. I mean, you and I both know very well independent primary care organizations today are feeling immense pressure to continue delivering high quality care while also keeping operational costs low. And there's no surprise why this pressure exists. Primary care is uniquely positioned to improve patient outcomes and reduce costs. There's a study that shows that $1 spent on primary care saves the healthcare system $13. So these organizations are really the answer to preserving healthcare delivery. So in order to sustain primary care, these groups have been looking into innovative ways to address and improve timely, affordable, and personalized access to care. And some of the major trends that we're seeing to address this is an increase in payment innovation and an increase in virtual care delivery. And as we've discussed, many of these are long overdue, but they are really shifting the way that care is being accessed and delivered. And primary care specifically needs a lot of support to weather this storm.
Couldn't agree more. I think that takes us to our next question really nicely. That's a great segue. So you mentioned payment innovation. What's a good example of a payment innovation that's really starting to show an uptick? And give me some pros and cons.
Yeah, definitely. An example of one is we're seeing a lot of independent primary care organizations introducing a membership fee on top of their existing fee-for-service model. So what this allows them to do is usually collect an annual fee to cover advanced or premium services that ultimately enhance access or timeliness to care. This type of innovation is most successful when it's being introduced into an existing traditional fee-for-service practice or model that already has an established panel to then layer on enhanced access to care. And we see this as a way for practices to reduce the administrative or operational costs in delivering high quality care while also being able to positively impact their bottom line. So, of course, in order to do this successfully, a practice must be set up with the infrastructure that actually allows them to guarantee timely, affordable, and personalized care back to the patient. And really think about, while I'm increasing or introducing the cost of care through a membership fee, how is this really going to enhance the patient experience while also allowing me to introduce a new stream of revenue? And as a patient that's personally been enrolled in both a situation where this has gone well and in a situation where it hasn't gone well, in the situation where it went well, I was able to receive greater access to care, more timely access to care, be able to reach someone within a few minutes of when I needed my care to be able to get my answers to questions that I had. In a situation where it didn't go well, it was simply introduced as, a new fee to cover operational expenses. And so practices that are introducing this really need to, above all, think about how it's going to enhance the patient experience to ensure this is successfully sustained.
Yeah, because you've got to convince people to pay that fee.
Exactly.
So it's got to be worth it to them. That fee's got to be in exchange for something that's really of value to the patient.
Mm-hmm. Mm-hmm.
Yeah, that makes sense. Great. Let's go to the next question. So, are there other payment innovations we should be talking about?
Yes, we've been seeing a lot of this in the news lately, but the sustained success of accountable care organization models as well as direct contracting model. These are models that are out of CMS's Innovation Center, and they continue to deliver savings in which the primary care entity is responsible for the total cost of care for an attributed patient population. And so a lot of the focus is how do we ensure that these patients are well served, have access to care, and how do we make sure the incentives are aligned for all parties involved to be able to sustain access and delivery of care. And the results of these two programs actually just both recently released for the 2022 performance year are pretty amazing. For the Medicare Shared Savings Program, that program saved about 1.8 billion for accountable care organizations, which is the second highest savings that program has seen in the past 10 years. Similarly, for the direct contracting model, which was a predecessor of the ACO REACH program that was introduced in 2021, that program saw that the DCEs enrolled in it earned 870 million in gross savings, which is actually 7 times more than the gross savings that those groups demonstrated in 2021. And the fact that that program kind of rebranded in 2021 and saw 7 times increase in savings for participants is pretty astonishing. So I think these programs are really demonstrating that capitation payments in which a provider is given a lump sum of care to care for and manage their defined population over the traditional fee-for-service reimbursement model is really generating healthcare savings across the board, as well as promoting increased access to care for our most vulnerable populations. So it's a testament to demonstrating that when you add in the right combination of infrastructure support and incentives, these programs are actually improving healthcare outcomes, and it makes this notorious concept of payment transformation more tenable and accessible for primary care providers and their patients.
It sure does. And for me, it really is a great illustration and brings to life the power of primary care to bend that cost curve, not by limiting care, but by improving outcomes. Are they looking at how this is improving outcomes as well, or is it just all about the cost?
Yeah, that's a great question. They definitely are looking at outcomes. Both of these programs have quality metrics where they're tracking the patient experience, patient outcomes in the conditions that are most prevalent for vulnerable or older populations. And they're seeing that those metrics are actually improving in this type of model as well. So the fact that they can actually effectively connect and demonstrate outcomes are also tied to financial rewards demonstrates that payment innovation can really influence positively the future of healthcare delivery and those outcomes for our patients.
So when we empower primary care to do what primary care does best, and we align the incentives to help them invest in that process, they actually do deliver. It actually
Exactly.
works.
Exactly. Yeah.
Love that. Okay, next question. Good. You mentioned in the beginning virtual care delivery. Let's get into that a little bit. Tell me what's going on there.
Yeah, we are seeing across the board, especially since the pandemic, um, in two main ways. One is through primary care organizations now increasing this as a service, as well as through the establishment and creation of startups or disruptors that are developing virtual first or 100% virtual care delivery models. And these are really meant to respond to a couple of factors that we're seeing in the market today. So responding to a demand for more affordable and convenient healthcare services, a a reduction of cost of care by actually rendering common primary care services through a virtual nature, and positively resolving barriers to care associated with social determinants of health. So if you don't have transportation, are not able to easily access your nearest primary care clinic, virtual care becomes the answer to ensuring that there is access to care. And ultimately, especially for conditions that can be addressed or seen through virtual care, we're seeing it's leading to improving the overall patient experience and outcomes. And there's a lot of studies that have shown that this trend is here to stay. So a recent study from the National Institute of Health showed that before the pandemic, 5.3% of physicians were using telehealth. That jumped to 46% during the pandemic. And now 70% of physicians that were surveyed in that study intend to use telehealth after the pandemic, compared to the 18% before. And this is even more prevalent or popular as an option with younger physicians and physicians that actually did not have training on telehealth in medical school. So the fact that this trend is now becoming even more pervasive and foundational to primary care delivery is really great in terms of the increased access to care. And another report from McKinsey in 2023 showed that telehealth adoption now makes up 14 to 70% of visits, compared to 1% in 2020. All this to say is virtual care appears here to stay and is now an option that is going to exponentially improve access to care and also provide an affordable infrastructure option for those that are looking to scale primary care delivery across the board.
Yeah, I mean, honestly, it's about time. I feel like we should have been doing this a long time ago. I know that it has been somewhat controversial, especially for the platforms that are 100% virtual. And I do recognize or acknowledge that that is, maybe not ideal. But my position on that has always been even less than ideal primary care is better than no primary care at all. So to the extent that virtual primary care can reach people who we otherwise could not have reached, and can keep PCP connected to their patient in that longitudinal relationship, no matter where the PCP or the patient are, without disrupting that, I think we really haven't begun to calculate the benefits of that. I would love to live in a world where you can, start with your PCP at a very young age and keep that same PCP as long as that PCP is practicing medicine, no matter where you live in the world, no matter what happens. I think that would be such a better way to go, instead of having to switch. There's a lot built into that, but virtual care is an important component of bringing that into reality.
Mm-hmm. Yeah, I couldn't agree more.
Great. Next question. Okay, so all of this disruption in payment innovation and virtual care and many other things we didn't even name today are probably creating a lot of turbulence for the primary care landscape. What kind of support is out there for independent primary care physicians to help them weather these changes and adapt successfully so that they can continue to practice independently?
Yeah, that's a great question, and probably an answer that a lot of primary care organizations are looking to seek out as well. A lot of what we're seeing is focused in kind of three main buckets, so I'll go through each one. I think the first one is really technology that's purpose-built for primary care and the transition to value-based care, especially with the infrastructure changes or trends I mentioned before as it relates to payment innovation, knowing which patient populations to pay attention to, as well as how to improve access to care. A lot of organizations now are looking for systems or partners that can provide them with the right level of data on their patient population, whether it's claims data, network data, inpatient data, any external data source that can really give them a comprehensive picture of who this patient is and what kind of care they need, and how can I proactively manage this patient. The innovators in the space that are really the most critical for primary care organizations are those who can then take those data feeds and present that data back in a way that's actionable. So how can technology really make it easier for providers to successfully manage their patient populations while also managing the transition to value-based care, managing the complexity of multiple requirements and contracts that demand their attention while keeping the patient top of mind. And technology companies are focused in this area to really be the key answer to these primary care organizations. A second area, or second partner in terms of support for independent primary care organizations are just the continued growth of independent physician organizations and physician organizations that are providing bargaining and negotiating power to these independent primary care organizations to either gain access to favorable rates or allow them to participate in the shared savings that exist through the programs I mentioned earlier, like accountable care organizations, Medicare shared savings programs, as well as the direct contracting program. So giving them essentially a lifeline to have that collective power to really reap the financial rewards of sustaining their phenomenal patient care outcomes. Lastly, we're seeing a trend with private equity or venture capital firms that are providing backing to fuel independent primary care organizations. So this includes providing access to capital, financial expertise, operational support to really build and scale models, industry insights, as well as management talent to really think about how to develop and build and scale independent primary care organizations in a way that continues to make an impact on patient care outcomes. So lots of innovation on those fronts, and really looking forward to seeing how each of those three strategies continues to unfold and what is going to really unlock continued primary care access and outcomes.
Got it. Yeah, so I wanted to double tap on those physician organizations. I don't know if you want to name any specifically, but I think it would really help our audience to connect that to what that means for them, especially if they are in small independent practice and need that lifeline. Can you kind of illustrate that a little bit with some real life examples?
Yeah, there's groups like Alidade that provide that type of infrastructure support, essentially allowing the primary care practice, especially the smaller ones that are comprised of 1 to 2 providers, to maintain autonomy in terms of the way they want to deliver care, what high quality care means to them in terms of how that's translated into their day-to-day operations, but providing them with the infrastructure support to be able to scale the way they're able to manage their populations proactively. So this might mean providing them with population health insights, providing them with additional financial backing to support purchasing decisions, favorable rates when it comes to insurance reimbursement, and also the ability to participate in programs like the ACO, so that way they're able to share savings across the board. So when the group of the independent practices are successful, the entire group will benefit on those shared savings, and then we'll able to see those financial benefits trickle down to them in terms of the way they're able to continue to sustain their unique way of independent care delivery.
Yeah, and I think the way that those organizations are organized are really nice because they really provide that enablement for folks that are, really stuck on the fee-for-service hamster wheel and don't know where to start. So I think that is a great way to get rolling with making that leap off of that hamster wheel and into the value-based arena. Feels like a safe place to land.
Exactly. And I think, across the board with the support these groups need is we're not hearing that folks want to stay in fee for service. We are hearing that groups want to be able to transition to value-based care, essentially take the path that's going to allow them to continue to deliver on their commitments to high quality patient care. And the fact that these tools and organizations exist to serve as a partner to help PCPs weather those changes is really what's going to be key to this success. So the more we can find technology, introduce these support organizations to primary care groups across the board, I think will allow us to expedite some of these changes, these much needed changes, and allow hopefully these groups to continue to focus on high quality care and their patients.
Absolutely. Well, thank you so much, Manisha, for sharing your incredible expertise with us. It was truly a pleasure to have you on the show, and I hope you'll be back.
Yeah, I loved it. Thank you so much for having me, and looking forward to continued conversations on this topic.
So if you have questions or feedback about this content or have ideas for a future episode, don't hesitate to contact us at marketing@elationhealth.com. And thank you to all of you who tuned into our discussion today. We're so glad you're here. To learn more about Elation Health, please visit elationhealth.com. To access our webinars and Pulse episodes, visit elationhealth.com/resources/webinars. All other inquiries go to marketing@elationhealth.com. Thank you.